Hi, my name is Naomi Campuzano. I will talk about hypoparathyroidism complication. Okay, 1 point, definition. Hypoparathyroidism is an uncommon condition with your body produces abnormally low level of parathyroid hormone PTH. PTH is key to regulating and maintaining a balance of two minerals in your body, calcium and phosphorus. Okay, the second point, application in medicine. Reversible complication and irreversible complication. Reversible. Crumpling span of your hand and finger that can be prolonged and painful. Seizures. Malformed teeth affecting dental enamel and roots in case when hypoparathyroidism occurs at an early age when teeth are developing. Problem with kidney function, heart arrhythmias, and fading, even heart failure.
Hypoparathyroidism is a condition where the patient is unable to produce enough parathyroid hormone. The most common cause for hypoparathyroidism is surgery. Sometimes hypoparathyroidism occurs following thyroid surgery. Sometimes hypoparathyroidism occurs following parathyroid surgery. Hypoparathyroidism can be very difficult to manage. What it translates into for the patient is a low calcium level, which we can monitor with lab tests, and we can supplement calcium and vitamin D. But sometimes people with severe hypoparathyroidism require supplements 3 times a day. Sometimes, despite that, they're taking frequent trips to the emergency room and requiring intravenous calcium medication to stabilize their calcium levels. So it's a real challenge. The best treatment for it is avoidance. And that is why minimally invasive parathyroid surgery has become so favorable.
Okay, pros and cons. The pros, accurate diagnosis and treatment might prevent this complication associated with hypoparathyroidism. The cons, bad arms, they occur calcium and vitamin D won't improve them.
Okay, now we're going to go over hypoparathyroidism, which is just an undersecretion of the parathyroid hormone, or PTH. The etiology of this could be a hereditary disorder, or if there's deliberate or inadvertent removal of the parathyroid tissue during surgery. Signs and symptoms include tetany, which is just muscle spasms, memory problems, depression, brittle nails, hair loss. This can also cause really painful menstruation because of that tetany and the muscles that don't relax. Diagnostic, the radioimmune assay reveals lowered PTH levels and also lowered serum calcium levels. The treatment is lifelong vitamin D and calcium supplements and a diet that is high in calcium and low in phosphorus. This would be a diet of dairy, fortified orange juice, and leafy greens. The prognosis is good with successful treatment, and there is no prevention.
Okay, application in Ecuador. It is important to agree at this college on the different types of treatment because Ecuador is an endemic area for this disease. So an early diagnosis will help prevent a complication. There are no official statistical data on this pathology, however, based on several local studies. In Ecuador, the incidence of hypoparathyroidism is approximately 5 to 8%, with a higher prevalence in women and those over 65 years of age. Okay, and finally, conclusion. It is important to know what this disease in its complication in order to have a quick and accurate diagnosis in order to avoid its complication and be able to be treated properly. And thank you.